Today, I would like to update members on the major healthcare initiative to focus on preventive care. It is called Health.sg. To make healthcare affordable, the government will have to continue to subsidize healthcare. And that is the key reason why additional revenue from GST increases is needed. Even so, the 2 percentage point increase in GST may not be sufficient, given the rate at which healthcare costs are increasing. That is why we also need to control costs. We have been doing so through bulk buying of drugs, using cost-effective treatments, better clinical procedures, right-siting patients, and moderating the buffet syndrome caused by healthcare insurance. But the more fundamental way to tackle costs is at its roots. That is to make us healthier. It wouldn't reverse the impact of an aging population, but it can reduce the rate of increase and bend the cost curve downwards in the long run. It will still slope upwards, but we can bend it downwards. We usually associate better healthcare with fascinating medical technology or heroics in the operating theater, that when we watch Grey's Anatomy. Those are important, but good health is more likely to come from an accumulation of the humdrum and the mundane. Because as the saying goes, prevention is better than cure. We need to, as Mr. Ang Wei Neng and Mr. Henry Kwek said, maintain health rather than treat sickness. That's why we are not called Ministry of Sickness. We are called Ministry of Health. The measures must be taken early when the person is still healthy. We must identify the risk factors in our lives that will erode our health slowly and quietly, and then address these factors. It must be done in homes and in the community, not in hospitals or clinics. It is best centered on family doctors in polyclinics and GP clinics, and less on surgeons and specialists in hospitals. Family doctors must then become the most important anchor of our healthcare system. This new strategy centered around primary care is called Health.sg. We have worked out the broad plan, but still finalizing the details. Over the next few months, we will be consulting different stakeholders, Singaporeans from all walks of life, GPs, healthcare workers, community partners, to gather their inputs and views. MOH will then flesh out the details in a white paper and table it in this House for debate.